Yeah, let's leave it.
All right. Hello, 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 and welcome to How to Teach Clinical with Confidence, even if you are new. Okay. This is live episode 5. Welcome to the show. So, if you're watching on Facebook or YouTube or a replay on LinkedIn, you are welcome. Hello, everyone, and welcome back to the Nurse Educators Bridge. I am Dr. Rose Sime, an educator, a simulationist, speaker, and a consultant. And today, we are diving into a big topic. Let me get some drum roll here, please. It's my sound, drum roll. Drum roll again. Yes. So we are doing how to teach clinical with confidence, even if you are new. So welcome to today's episode. So let's say if you are transitioning from bedside to education, and if you are hired at the last minute to teach clinical, or if you love teaching but you still feel nervous walking into the unit with students, this episode is for you. Okay? So before we begin, please drop your comments and let me know where you are joining me from and what specialty do you teach or want to teach. Okay? And I'm going to go ahead and share my screen, and then we're going to begin. All right. So our presentation is like, how do you teach clinical with confidence even if you are new? So remember, this is our topic for tonight. Okay. So let's talk about why new clinical instructors struggle. Why do they struggle? So let's talk through. Even the best bedside nurse may feel unsure when teaching clinical. You are an expert on the bedside, but you're going to do something new. You are not alone. So here are the top reasons new nurse educators feel unprepared. Rosie, can't tell Daddy that I'm lying. That I'm on live, please.
Oh, okay, sorry.
So here are the top reasons. So we're going to talk about the top reasons why new nurse educators feel unprepared. So that usually there is no formal orientation. Sometimes you are called in the middle of the semester and then boom, there you are. You're a new clinical instructor, right? There are unclear expectations from the school. You've been called, hey, you're going to teach clinical, and that's about it. You have been sent to go do it. All right. And then you also have your own fear of being judged by staff and students. They're probably going to say, oh, am I confident enough? And all that other stuff. And the other one is not knowing what good clinical looks like. And then balancing student safety with your independence. So these are the top reasons why nurse educators feel unprepared going to clinical. There are so many other factors as well, but these are the top reasons that I think. And as a new clinical instructor, I felt that one too, years ago. All right, so now let's talk about some things that will make you feel like you are an effective clinical instructor. Okay, So how to teach clinical with confidence? What you need. There are three things that you need. Number one, a clear teaching framework. Okay, so proven models and methods that are out there that you can use is a structured approach to lessons and a consistent delivery. So find your own ink, the one that will work better for you to do that clear teaching expectation. So use framework that will work for you. All right. And then number two, support from the school. Okay. So you need orientation, you need communication skills, you need tools. How do you communicate, right? So there should be some resources, some policies and stuff in place to support you so that you are successful, and you need to work in unison with the school. Okay. And the third one is a consistent structure for your clinical day. So you want to be consistent. You want to have like, you organize your schedules. You're going to have some clear goals and objectives and time management tools that you use to structure your day to teach your students. So when you have a day which is well structured, you feel confident and your students also feel safe. So these are some, things that can make you feel that you are an effective clinical instructor. Please join me, invite somebody to join as this live is going on. Okay. All right. I'm going to make sure that I have the live on my phone so I can see comments, or if somebody joins me and they have comments, then I can see all that. Okay. So give me a minute. I'll be right back. Okay. Let me continue on. I cannot get it changed for the life of me because I'm on live. But anyways, let me continue on. So now let's talk about how you are going to structure your clinical day. Okay? How you are going to structure your clinical day. Okay. So the first, I'm going to give you some phases. So I call this one, this is what I call the Dr. RKS 4-phase clinical flow. Okay. I'm going to give you 4 phases of clinical flow. So use this for any clinical rotation. All right. The first thing you want to do is to welcome your students. So when the students come, you welcome them. Welcome to your first day of clinical, or welcome to your second, whatever day it is, welcome them to your clinical place. Okay. You're going to welcome them to clinical. All right. And then you're going to have quick announcements. So how do you want, how was you excited that they are here? And this is where we're going to be for the next 8 weeks, and this, and that. So there is some excitement. Give some announcements. Let your student feel that, you are there for them. All right. And then also let them know the expectation for the day. So today, my expectation is, right? So by the end of the day, you should be able to do an assessment. Maybe if it's respiratory, you can do a full respiratory assessment on a patient, or if it's bed bath, any skill they are doing that day, let them know exactly what your expectation will be. The assignments or the patient load they're going. You're going to have one patient, you're going to have two patients. How that day is going to be, let the students know about their assignments. And then give them some safety reminders, like, make sure the bed is locked, or if you're leaving a patient, make sure you leave in a call light bell with them and all that other stuff. So you want to say something like, when it comes to the tangible skill, you want to say something like, by the end of today, you should be able to demonstrate how to safely transfer a patient from the bed to a wheelchair, or how to safely give a bed bath to a patient in bed. So this is what you want to do. The first one is to have a pre-huddle. So during the huddle, you tell your students all these good points that I am giving you. Okay. So these are things that you want to do in your pre-huddle. Please, if you are joining me, thank you. And please share the live. Share the live. Share it for me. Okay. Share the live. Share the live. Thank you. All right. So now let's go to phase two. After the huddle, you're going to phase two. Phase two is what? Bedside and skills-based teaching. So what is your role as an instructor? What is your role as a clinical instructor? Your role is to observe the students. Your role is to coach the student. And then your role is to question for critical thinking. You're promoting their critical thinking. And then your role is to redirect the safety if there's any issues going on. And your role is also to document their progress. So when you are doing the critical thinking piece, use phrases like, walk me through your plan for today. As the student, let them walk you through their plan. They've gotten their patient, they've gotten what they are supposed to do. Ask them, now walk me to your plan. When you're going to your patient, what's your goal going to your patient room? And then let them talk to you. And also let them, then like, what's your rationale? If they do something and then you say this, like, what's the rationale? What's your rationale of doing XYZ? Let them see. That will let you know what they are thinking. And then you can also ask them, what are two risks for this patient, right? You're taking care of this patient. What are two risks for this patient? So you're asking them questions like that to encourage them to develop their critical thinking. All right, now we go to phase three. Phase three is something like the makeshift check-in. You had the huddle, you gave them what you want them to learn. Now you're doing a makeshift. So in the middle of the day, you want to go around, ask your students, right? What's going on well for you today? How is it? It could be the interaction with the patients or the patient family or the nurses or the people that work on the floor. So you want to feel what is going well that day. What if they have some challenges? You're gonna ask them, what challenges are you facing today? All right. So this allows your student to tell. You're not waiting at the end of the day. At least midway, you are checking to see how your students are feeling. And then also, what do you need support with? You're going to ask them the kind of things that they need support with. So when you're doing this, it prevents overwhelming from both you and the student. So you are checking in and then you're seeing how everybody or how everything is going midway. You're not waiting till the end of the shift to be asking all that. Okay. And then as you continue on to walk around and see what all the students are doing, from there, you are going to move to the post-conference phase. You want to give time for your students in order to complete your post-conference, all right? You want to have time to sit down. They find a quiet place away from the floor in either the break room or in the conference room. You want to sit somewhere and then you want to talk to your students. How are you going to do that? You are going to reinforce learning, reinforcing what did you learn today, what's going on. So you are trying to bridge the learning gap from the lab and the classroom to the patient setting area. All right. You are reviewing one patient case. So at least each of your students, you can either do one a day or one student a day, or you let each one of them present their case, the patient that they took care of. How did they go? How did they do it, right? How did they care for the patient? And then have discuss clinical judgment. So if they present their case to you, they present their patient to you, you want to get into their thinking. How did they arrange? Just like those questions you asked them earlier, walk me through your plan. How did they go? How did they go through the care of their patient? What was their priority? So you are discussing all that whilst you are encouraging them to critically think about their patients. It's very, very important for you to do that. Okay. And then you want to reflect. You want them to reflect on the wins of the day. Remember, we're talking about what's going on well, right? And the areas where they need growth. And you don't want to say what went well and what went wrong. You want to talk about the winnings and the areas for growth areas. That's what you want to do. Things that they will do better the next time, or where they need to grow on. So you want to insist on that portion, where is the growth area, right? And teach one focus mini lesson. So due to the like how the students are presenting the cases, what's going on through the day, you can come up with a theme of what's going on that you want to teach them. Focus on one section that you want your student to grow. Students will love structure. The students love structure. So this solidifies the learning journey and promotes their future growth. So you want to do that for your students when you're having your post conference. And like I said, post conference is like debriefing. You are debriefing them. What did they do? What went well? What did they see? Sometimes some of the things that we teach them in lab, we're using the textbooks. And when they go to the floor, the things they see, it contradicts. So you want to have time to really talk to your students, see how they're feeling, what went on the floor, and all that good stuff. So you are able to correct some of the things. You're able to give that focus mini lesson that you need to give to your students. So that once you keep doing all these things, you will feel confident because you always know what comes next, right? And your students will love that. Okay, so this will end. These are the four phases that I was going to teach you. Now let's go to the next section of our lesson today. So the next section is like, what must you ask the school before you start? So remember, I'm giving you all these things in your toolbox to get you ready to start clinical. What must you ask the school before you start? Here are some questions. A new clinical instructor, usually people don't have questions. You go for interview, they ask you, do you have any questions? You are like, oh, no, no. But these are things that you should absolutely ask. So write these things down and then ask, what are my exact responsibilities? What do you expect me to do? Right? What are you expecting me to do? Number two, what are the clinical course objectives? What do you expect me to teach these students, right? What level are these students are? What kind of course objectives are we working on? All right. So you need to know that. Number three, how many students will I have in a class? How many students do I need? Right? How many students do I have? Right? And number four, is there a clinical handbook or an evaluation tool that I need? And I will probably need an education on how to use it. So you want to find out all that. And who do I call for issues on the unit? So you know not to go to the next manager when you're having issues with your students or any issues that are going on. You're calling the school, the contact person. So you want to know all these things. In case there is a student behavior or any unsafe practices, site changes, and exposure incidents. You want to know all these things so you know who to report it to. So asking all these upfront saves you stress, confusion, and last minute surprises. All right. So you want to know all these before you start. So ask this question. It's very, very important that as you're beginning your journey, you ask all these questions, write them down, and have that. So asking these questions upfront saves you stress, confusion, and last minute surprises. All right. Okay. Now let's move on to the next slide. So the next slide is what here is the part that new instructors love, okay? To teach clinical with confidence, use this formula. Remember this formula that Dr. RKS is giving you. It says confidence equals to clarity, structure, communication, and support. So I call these are the four pillars that is going to help you build your confidence and that makes you unstoppable. So you're going to ask for clarity about your role, remember, structure your clinical day, okay? And then communication with the student and staff is very, very important. All right. And then you're going to need to get support from the school. Support from the school. So you need all these to build your confidence. You are on your way to building confidence, my friend. Okay. So if you build these four pillars, your confidence becomes unstoppable. All right. So that brings me to the end of my presentation. So now let's talk about what we learned today. So thank you for joining episode 5 of the Next Educators Bridge. Today, excuse me, what did we cover? We covered what makes clinical teaching challenging. We also discussed a structure you can use even tomorrow, and then questions you should ask the school, and then I gave you a confidence formula for new education. So remember these four things that we talked about today. What makes a clinical teaching challenging, a structure you can use tomorrow, questions you may ask your school, and confidence formula for nurse educators. All right. So now to our final slide. Before you go, if this episode helped you, type in the comments helpful in the comments, okay? And make sure you follow for episode 6 next week, all right? I'm going to post the replay on LinkedIn right after this section, okay? And next week's topic, let's get some applause here, please. Yay! And then next week topic, drum rolls, please. Let's do another drum roll for next week's topic. Yes. So for next week topic, we are talking about who you must become to teach clinical effectively. So remember, you are an expert nurse. So the expert nurse to an effective educator. So who you must become to teach effectively. This is the topic for next week. Send it to somebody. If you watch this episode, send it to somebody you know who is on the fence, who's a new instructor, looking for mentorship, looking for resources to be successful in teaching. This is what Dr. RKS is doing. So remember, I am Dr. RKS Rose Kronzian Semi, helping nurses cross the bridge from bedside to classroom with clarity, confidence, and purpose. So you all have a beautiful evening, have a beautiful night, and keep shining. And I will stay around and see if you have any questions for me. Thank you. Yay. Thank you for coming. All right. We're all done. See you next week. Bye.